Okay, this video is a book review. The name of the book is Natural Health by Andrew Weil. This is Andrew Weil. And a couple things about this guy. Look how fat he is. And for a long time, he was quite fat, even fatter than that. I can remember seeing pictures of him. I thought he was fake. I thought he was sort of like controlled opposition sent in to discredit alternative health practices. And I can tell you, when I look at this book, I think this book is stupid. All right, and you'll say, I'll just read you like one section. This is on page 3. He says, what should you eat? Well, the first guideline I can give you is that there is no one right way to eat, no one right diet. A particular diet might be right for you at this stage in your life, but it might not be right for me, and it might not be right for you a year from now. Every one of us is different physically and biochemically, with different and changing dietary needs. It's on page 3. Don't believe anyone who tells you that all illness results from a poor diet or that dietary change can cure any illness. Okay, that's absolute nonsense, okay? Humans have a tremendous amount in common with each other about what's required for a healthy diet. You can look at populations of millions and billions and see when they're all eating the same diet, whether it's good or bad. So this is like, you've heard of moral relativism. This is dietary relativism. And what it does is it handicaps the reader and basically tells them nobody knows, so just eat whatever you like. Okay, it's completely stupid. And I think it's irresponsible for a doctor to write and talk that way. And here's this guy who's promoted as being, Mr. Wonderful in the alternative, they call it integrative medicine community. All right. And then here's another thing he said, another thing just absolutely stupid and incorrect on the topic of water. He says, one possible concern for people who are drinking mineral-free water is that it could be too low and it could be lacking fluoride. Your children will not be getting enough fluoride that they need to form strong teeth. Let your dentist know so that he or she can prescribe supplemental fluoride. Fluoride has been shown to lower IQs in children, that it's a brain neurotoxin, that it makes very little difference for improving dental protection from tooth decay from cavities, that it causes spinal skeletal fluorosis over time, that it's been shown based on the work of Yomi Mamis. It's hard to say his name. He wrote the book Fluoride, the Aging Factor, to damage proteins like collagen, substitute out for hydrogens, and disrupt the collagen helix. That can also cause autoimmune disease. There's tons of problems with it. It inhibits glycolysis, it inhibits Krebs cycle, the tricarboxylic acid cycle, and it inhibits electron transport. What more could you want to minimize your energy metabolism? It's a carcinogen. So he's recommending that for your kids. He's telling you to poison your kids. Okay, he's an idiot. He's an idiot or a liar. That's BS, all right? There was one chapter in the book that I found a little bit interesting. Let me go to that. Okay, this is a picture here of my mother. And my mother is Puerto Rican, super nice lady, the best person I ever met in my whole life. And when one of her grandchildren was very sick, was born in septic shock, put on an ECMO, an extracorporeal membranous oxygenation, a heart-lung bypass machine. Everybody thought the kid was dead or mentally retarded. They ran a code blue on him for hours. She basically put her life on hold for the next 3 weeks, moved into his ICU room in the pediatric NICU, neonatal intensive care unit, slept on a cot. At the current time, when this was going on, she had metastatic cancer, colon cancer, metastatic to her lungs. She's coughing up blood every day. She's hiding the blood in the garbage can so they don't kick her out. But, she's in there with the baby, and it's going to make sense why I'm telling you this. It's going to go right to the book here. She's calming the baby down. I'm with you. I love you. You are going to be okay. And the kid made a full recovery. The kid came back to normal. Kid was a really good athlete in high school, graduated from college as an honor student. So anyways, I just want to read you what he wrote here. I think you might find this interesting. It was interesting to me. Okay, this is on page 166, subtitle Connecting with Family. An anthropologist friend of mine was once teaching a section of a course on Native American society at Harvard. In the class was a Native American young man. In talking about social organizations, my friend kept referring to the extended families of Indians. Finally, the Indian in the class interrupted him, saying, "Excuse me, but we don't have extended families. We have families. It's just that you people here in the USA, you've got contracted families." The nuclear family of our modern society is indeed contracted. Human beings want and need the intimate support of a real family. It is hard not to look at the extended families of other cultures with wistful longing, if not outright envy. Where I live, in the southern Arizona, the Hispanic population seem way ahead of the rest of us in providing this need. For example, there are no Hispanics in the nursing homes here. By the way, you can read that in two ways. There's no Hispanics in nursing homes because they don't have enough money to send them, but also because, they keep their family member at home, which I'm sure the family member prefers. He continues, nursing homes are where we put our old relatives when we no longer want to take care of them. In Hispanic families, the old people, even when sick, continue to be valued members and live at home. A nurse at the University of Arizona Medical Center who attended one of my courses told me that she worked for a number of years in the pediatric intensive care unit. During her time there, she said she saw 12 children recover miraculously from apparent fatal head injuries. They had been in bicycle or motorbike accidents and were in the deepest coma, had flat EEGs, almost brainwave patterns, and were given up for dead by the attending physicians. The organ transplant teams hovered around, waiting to take the kidneys and hearts. She saw 12 children in that extreme condition come back to full consciousness and life, to the amazement of her doctors and the annoyance of the organ transplanters. What caught her attention most was that all of these families were Hispanic. In her words, "I've never seen an Anglo kid recover from such an injury. And do you know what the difference is? When a Hispanic kid is in a coma like that, the whole family is around the bed day and night, talking to him, praying for him, loving him. The Anglo kids are there all by themselves, unconscious children in beds in intensive care all alone. We are not meant to be all alone. We are meant to be parts of bigger families, bands, and tribes. Don't settle for nuclear family contraction. Extend." So, on the one hand, you have to ask yourself, his friend teaches Native American studies and, there's sort of a little bit of Anglo white people bashing, and there's a lot too much of that these days. But on the other hand, I do think there's something to the warmth of Hispanic families. Because like I said, I've been to Puerto Rico, visited all my relatives a couple of times, and they are so warm and friendly and tight. And I know lots of Mexicans, and they're very friendly and nice and warm and very family orientated, the ones I know. So I do think there is something to say for that. They have more of an extended sense. I do think there's a trend in USA society to break the families apart. All these women filing for divorce. I can tell you, I was at work and I was talking to this one lady about my divorce, and another lady was listening to it, a secretary lady, and she heard me talking and she said, "Dr. Rogers, you called your wife fat? How could you do that? That's mean. That's cruel. If I was your wife and you called me fat, I would want a divorce. I would file for divorce." And I'm like, are you kidding me? Is your emotional volatility that high that just being called fat would be grounds for divorce? My wife is really fat, okay? If I said it is for her own benefit. And so what I'm trying to say is that's a total overreaction. And a person breaking up their family just because of that. I get called at least 10 names every day. I don't even pay any attention. I mean, it's nonsense, okay? Well, anyways, I do think Andrew Weil is a BS artist. Maybe he is good at some things, but I wasn't too impressed. Anytime I see somebody who's fat, it's hard for me to take them seriously when they talk about nutrition. So anyways, there it is.